can hold it all the way till we get home and we're just about to get to our bathroom and we'll pee our pants. Why does
Okay.
that happen?
Because you went home. That's it. It's called urge incontinence, and that is an actual, like right out of the textbook thing that you just described. It's called key in the door incontinence.
Yes.
Hi, everyone. This is Raquel.
Hi, and this is Jennifer.
Welcome to Madness Cafe.
This is a feminist podcast where we talk about women's issues, politics, and health and wellness.
And where those issues intersect. Hey, everybody. Welcome back to Madness Cafe. Today, we are going to talk about a topic that, as far as I can tell anyway, really doesn't get talked about very much and definitely not enough. We're going to be talking about pelvic health. And our guest to talk to us about this today is Judy Rossi. And Judy graduated from physical therapy school at California State University at Long Beach. She later received her doctorate in physical therapy and her pelvic health certification through Evidence in Motion. Judy began her journey in pelvic health after spending most of her career as an orthopedic physical therapist, most recently as co-owner of a large outpatient orthopedic practice in Cherokee County, Georgia, before selling it in 2019. It was her own physical challenges that were solved through pelvic health physical therapy that motivated her to specialize in pelvic health herself. While this occurred later in her career, she has truly found her passion in this realm. Opening her business, Woodstock Pelvic Health, again here in Georgia, allows her to provide compassionate care to those with pelvic health challenges. Thank you so much for being here, Judy, and talking to us about this. I think this is a really, really important topic for us to be aware of. So thank you for being
Thank you.
here.
Thanks for having me. I appreciate it.
I think the biggest question is, how do we know if we need help with our pelvic health?
Well, there are some certain red flags that would let you know. Things like urinary leakage or fecal leakage would be a definite red flag.
Mm-hmm.
Pain with intercourse, feeling like things are falling out of your vagina or your
Oh,
rectum,
Mm.
um, having to go to the bathroom very frequently, even when your bladder is not full. Those are probably the big ones.
Some of those sound like things that can be maybe lumped in with other stuff, like, oh, it's just menopause. Oh, it's just this. Oh, it's just that,
Right. Yeah.
which makes me think that maybe it's pelvic health issues maybe are either misdiagnosed or not diagnosed at all.
Correct. So unfortunately, the probably at least half of my patients come to
Mhm.
me because they do their own research. So they've been to, a lot of them have been to multiple doctors with the same complaint, and they've been either blown off or given a medication that didn't really help them. In the case of women who say complain about pain with intercourse, they'll
Mhm.
tell them, oh, it's just in your head, or just drink a glass of wine and relax, or, maybe you need to go talk to somebody, or, those kinds of things,
Mhm.
and just not really give them, they don't hear them out. And so these people just do their own research because public health has become much more well known in the world now, thanks to social media.
Oh, good.
Yeah, so a lot of people find help that way.
Mhm.
Yeah.
When I was doing research on this, getting ready for today, it seemed like there was a lot of the information was more about what am I trying to say? Like more about like, oh, do Kegels or oh, you know what I mean? Like it didn't seem like
Mm-hmm.
there was really it didn't seem like very broad information,
Okay.
at least is what I found. So is there still a lot of misconception or maybe lack of information
Mhm.
or maybe misinformation that's out
Yes.
there?
Yes. And I may look at all of this through a different lens than
Mhm.
when you did your research, maybe you just didn't search for the right things. So you didn't find
Mhm.
the information, but
That's highly
Um,
possible, yes.
yeah. So if you went to Instagram and searched pelvic floor physical therapy,
Uh-huh.
there'd be like a bunch of uh, pages that would pop up with a lot of good information there. So I think that's
Okay.
what a lot of people do is they go to social media more than
Okay.
even Google. A lot of OBGYNs don't even understand the pelvic floor, which is kind of shocking because that's should be in their realm of what they're
Right?
taught. But I've been told by OBGYNs that refer to me that they are not taught anything about the pelvic floor. They don't even know how to examine it. So, yeah, right. So the few that do know, they're the ones that will send people, but even my own OBGYN who I've gone to for 25 years, and I think she sent me one patient in all that time. When I go to her, before I became a pelvic floor therapist, I knew I had a certain degree of prolapse, which is pelvic organ prolapse. And when I asked her about it, she says, well, just make sure you do your Kegels. Well, as it turns out, that doesn't really help prolapse. And
Oh.
she should know that. And in my case, I had an overactive pelvic floor, which would have just made my symptoms worse by doing that. So that's one of the misinformation things that's out there is people think I don't need to go to a pelvic floor therapist because I can figure out how to do a Kegel on my own.
Right.
Yeah, it's not that they're overrated.
What is an overactive pelvic floor? I've not heard that term before.
So so the pelvic floor, maybe I should explain what the pelvic floor is for
Oh yeah,
those
that's a good idea.
Yeah,
Yeah.
yeah.
listeners who may
Let's
not
start at the
know.
basics.
Yeah.
Yeah.
So it's a group of muscles that lies at the base of your pelvis and it goes from your pubic bone back to your tailbone. And there's several different muscles and they kind of form a sling. So any muscle in your body can get overly tight. Have you ever had
Mm,
a pain in your neck, where you've got a knot that you can push on and it's really tender?
All the time.
Most people can relate to that. Um, you can get those in your pelvic floor.
interesting.
And those muscles can cause, if they are that way, they can give you the sensation that you have to pee all the time.
Mhm.
That's what I actually had. So I had something called painful bladder syndrome, which is what sent me to a pelvic floor therapist, which I had to figure out on my own, by the way. Um, and
Women's health.
yeah, so yeah, I went to a urologist and they just kept giving me medications that didn't help me.
Oh.
And
Sorry that
so I
happened.
went to a pelvic floor therapist because I read up on it online that that might be one intervention for what I was dealing with, which I had been dealing with for almost a year. Um, I had to get up and pee like 7 times a night,
Oh
every
my
hour.
Wow.
gosh.
I couldn't sleep unless I put an ice pack over my bladder. So, but it turns out I had some knots, so to speak, in my pelvic floor that just
Mhm.
had to be worked out. I had to do specific exercises to learn to relax them. And after 3 or 4 months of that, my symptoms went away
Oh
and
wow.
and rarely do they ever come back. But if they do, I know what to do about it.
So when someone is experiencing like more of a leaky bladder or they can't, they sneeze and they can't quite hold it in, is that the opposite then? Is that a underactive?
It can be, or it can be an overactive, believe it or not. So,
Oh,
so if you were to take a ball and squeeze it as hard as you could, and I
Mhm.
just told you to hold that for a few minutes and then let go, and then I decided to check your grip strength would be poor because you had been squeezing that ball for so long. So somebody with an overactive pelvic floor can also leak because their muscles are so overactive that they can't work properly.
mm.
Mm.
So the only way to know if it's an underactive or an overactive is to have an exam done to determine if your pelvic floor strength is good, bad, or whatever it is. And there's other things that can cause leakage just besides just a weak pelvic floor.
On your website, you said that often the pelvic floor is the victim of other dysfunctions in the body.
Mhm.
I wrote down that same quote.
Because it's interesting. It's
Yeah.
very
Yeah.
What does
interesting.
that mean, right?
Yeah. What does that mean?
Um, so a lot of people who have pelvic floor dysfunction also have some kind of injury to their lower back or their hip, one hip or the other or both. There's a lot of muscles that are part of the pelvic floor that also are hip muscles.
Interesting.
So if someone, say, injures their hip doing something, running, for instance, and they suddenly start developing urinary leakage or painful urination, or they have to pee all the time, or suddenly it's now it hurts to have sex, it could be that the pelvic floor became the victim of that hip problem or that back problem.
Mm.
So that's what I meant by that.
So are some people more prone to pelvic floor problems than others?
It depends on which thing you're talking about. So if it's
Okay.
a weak pelvic floor, let's say it's not an overactive, it's just plain old weak, that can be the result of pregnancy or immediately postpartum
Okay.
from just having the pressure of the pregnancy, and then vaginal birth can also cause some strain and stress to the pelvic floor.
Yeah, clearly.
Yeah, imagine that.
Clearly,
Yeah.
The pelvic floor muscles are the only muscles in the body that can stretch 300 times their normal length in order
Oh my
to birth.
gosh.
But
Oh,
sometimes, even though they can stretch that far, they still tear.
Well, yeah.
Yeah.
ooh, ooh.
And so if you have a history of tearing with vaginal birth, you're more likely to have urinary leakage. You're more likely to have pelvic organ prolapse.
So tell us a little bit about, you said that the only way to really tell is to come in for an exam. And I'm sure people are a lot like me and they go, oh, exam. I don't want, that sounds scary.
Yeah.
I don't want to do that. What is the exam like?
So my exam starts out first with just getting the person's history. So my office is set up not like a doctor's office that you would go into. It's not sterile. I've got a couch and I sit in the chair I'm sitting in right now, and we just talk first. I try to get people comfortable because I know it's an uncomfortable situation that they're in. And then we do I look at their mobility, their posture, how they hold themselves, all in standing. And then I have them lie down still with all fully clothed and check out things like hip mobility, core strength. In the case of any woman who's given birth, I check for what's called the diastasis, which is the separation of the abdominal muscles. Um, so I go through a bunch of
Just
tests
another
like that.
joy.
Yes. I go through all those kind of tests, and then I always get their consent. I've not been turned down more than a handful of times to do an internal exam because I explain to them, I've got charts, I've got models, and I show them what I'm going to be checking. And most people just want help and they just want to be
Right.
fixed. So they don't care. And most women have already, had many pelvic exams in their life. My pelvic exam is not like going to the OBGYN. I don't use stirrups. They're just lying down on a table, and I actually sit on the table next to them, and I just use one finger and I check each side separately. And I check for any tender points in those muscles. I check their strength, their endurance, their coordination, whether their muscles contract when they cough, things like that. And
Wow.
if they have any kind of a bowel complaint, which is a common thing, which we have to do a rectal exam too. And I typically wait until the second visit because I feel like that's even more upsetting to people to do that. So I try to just kind of ease them into that.
Sure, that makes sense.
I want to just pinpoint what you said when you first started answering this question, is that you sit down and you talk to them and you spend time with them to
Hmm.
get to know them and get to know their history. It's not just, hey, fill out this form, come on in. Let me
Right.
start asking you questions that are gonna make you uncomfortable and then, okay, drop trowel, I
Yeah,
mean,
right,
you're really spending time getting to know the people and make them feel comfortable so that you can, because as it says on your website, that you take a holistic approach
right,
to what is going on with this person and what might be leading to their issues.
right.
Have you noticed a lot of the stuff you talked about may or may not be pregnancy related. Is there difference in pelvic floor health for people who give birth vaginally versus those that have C-section? And are there more complications either way, or it doesn't matter?
Well, it does matter. There's pros and cons to both. The
Hmm.
C-sections aren't, people who have C-sections aren't saved from having pelvic floor problems necessarily because just being pregnant is a stress on the pelvic floor. Having an incision in your lower abdomen creates another host of problems, like scar tissue that can develop years later, even. Um,
Jesus, years later?
Years later, yeah, scar tissue can grow over period years and cause things like
Lots of
small
problems.
bowel obstructions and things like that. People who give birth vaginally and tear are, like I said earlier, more likely to have incontinence or prolapse. So it's like you really can't win either way. Pregnancy and childbirth is just not easy on our bodies.
All right, let me ask another question that maybe it's silly. Do men have some of these problems, or is this just specifically a
Mm.
women's issue?
I
No,
was going to bring
men,
up men too.
yeah, men do. So I do see men. Um, they're the men that I see typically have been to 7 or 8 different doctors.
Oh my God.
Oh
So
my
it's
God.
actually even worse for men than it is for women. Um, so they have things like testicular pain, penile pain, urinary frequency, even some of them start leaking, even young guys.
Hmm.
Um, Pain with ejaculation, pain with intercourse. So they can have all the same things. And it's partly their pelvic floor muscles, but a lot of times it's also coming from their spine. So that's
Hmm.
why the holistic approach is so important because you have to identify where's the source of it coming from or what are all the sources of the pain.
So
So
when it's the spine, is it that the spine is tight?
It can be, it just depends. For instance, I had a male patient who was in the military and had a gunshot wound to his like through his chest
Oh,
and
wow.
had a chest tube and the nerves that came out of his spine at that level where he was injured go down through what's called the inguinal canal, which is that crease kind of right above your hip, and
mhm.
those nerves go down to the testicles, and that was his complaint. He had terrible testicular pain that felt like he was getting shocked with a cattle prod.
Wow.
And
Oh
so
my
it,
God.
until we had to treat his pelvic floor because those were tight, probably just from spasming due to the pain, but also I had to treat his back and try to free up the nerve that was being compressed.
When somebody goes through physical therapy for pelvic floor issues, is there a way for them to maintain
Yes.
so that, okay.
So fortunately, the vast majority of people that I treat
Mhm.
eventually are symptom free. Now it can take, it depends on how chronic their condition is, how long they've
Mhm.
had it. The average number of times I see people just over the years is 9 times. It's just been
Wow.
yeah, it's weird how often it turns out to be 9 times when they come in and say, well, I'm like 90 to 100% better. And that's when I discharge them. But they occasionally, like if they have painful bladder syndrome, like I had, that is a condition that typically has flare-ups. So those people will sometimes come back to me for a couple of treatments to get
Mhm.
over the flare-up. But other than that, most people don't need me anymore once they get well.
And
Okay.
what, it's probably all different, but what does a treatment look like?
It just depends on what I find, but let's just say it's somebody with an overactive pelvic floor, and
Mhm.
let's say they have, well, I'll be very specific here, somebody who has pain with intercourse.
Okay.
Um, that can be from a number of things. One condition is called vaginismus, which is a condition where the muscles of the pelvic floor close down so hard that nothing can go in there. And
Oh,
some of these people have not, could never even put a tampon in their whole life.
Oh my gosh.
A lot of them that have seen are women who found out on their wedding night that they couldn't have sex because they had saved themselves for marriage.
Mm,
So for that particular condition, the treatment is me trying to do manual therapy vaginally to try to get those muscles to relax. And then we use what are called dilators, which kind of look like sex toys. They're like the shape of a penis. And
mhm.
they start very small, like about as big as my pinky finger, and then they go all the way up to this size of a average male penis. And so over time, we work on, they have to take them home and do them at home as well. And we work on just over time getting those muscles to relax. And that
wow,
can take
that's
a long
interesting.
time. That particular condition can take months to get over.
Mhm. We've mentioned pregnancy and childbirth and traumatic things like being shot in the chest. What are some other things that may lead to pelvic health issues? I mean, can it just be like stress? I mean,
Yeah. So I, I guess going back to your question, are there certain people that are more likely to have this problem? So I would
mhm.
say people who are more type A, maybe high level of anxiety, tension, maybe they have tension all over their body,
Oops.
which is me, which is me. That's how I wound up with that
which,
problem.
which is everybody that I know.
Right. Yeah.
I mean, it's a tense world out there.
It is
Yeah,
a
it
tense
is.
world out there. Yeah.
Yeah.
So even though I'm not a psychotherapist, I think I've had enough therapy, psychotherapy myself to like I could play one on TV. So
Yeah,
I,
same.
I can talk them through a lot of things to help get their nervous system to calm down. I
Mhm.
give them homework and things to do, like guided
Oh,
meditation and listening to binaural beats and things like that.
that's so interesting.
So,
Now, my good friend and I both are, we're kind of like ex-runners right now. We've both
uh-huh.
had an injury and we're just walking, but we were just laughing the other day about how we can be out on a run and have to go to the bathroom and we can hold it all the way till we get home and we're just about to get to our bathroom and we'll pee our pants. Why does
Okay.
that happen?
Because you went home. That's it. It's called urge incontinence, and that is an actual, like right out of the textbook thing that you just described. It's called key in the door incontinence.
Yes, that's exactly what
And
No
that's
way.
exactly what happens.
yes,
We were both laughing about it. We'll run
right.
through the entire neighborhood, but the minute we're home,
You
can't
pee
make
your
it that
pants.
final step.
Right. Well, I'm going to tell you what to do about that.
Okay, great.
Well, first of all, make sure your bladder's empty before you go on your run.
So hard to do.
Yeah. Or as best you can. But then when you get home, you have to imagine your bladder is, do either of you have children?
I do.
Okay.
Jennifer does. I don't.
Okay. Well, when your children were little and you would go to the grocery store and you're at the checkout line and they start begging for the candy and the gum and all that stuff. And if you give in, the next time you go to the store, they're going to do the exact same thing, right?
Oh
So
no.
your bladder's like a spoiled child that you have to teach your bladder that you're in charge, and this is how you do it. So I know this is going to sound impossible, but you're going to try to delay going to the bathroom by doing things like before you even get close to the toilet, you stop in your tracks and you take some deep diaphragmatic breaths.
Oh,
So
that sounds so hard.
So I just saw your shoulders rise up when you took a deep breath. That's a sign you were not using your diaphragm. So
Oh,
a diaphragmatic breath, your belly should rise and your rib cage should go outward. So I teach
okay.
people to do a diaphragmatic breathing by having them put their hands on their ribs on the outside of their rib cage and then breathe into your hands and imagine there's a hand on your belly and you're expanding those areas and trying not to breathe way up in here. So that's
Okay.
step one is you do some diaphragmatic breathing and then you take a circuitous route to the bathroom. Like let's say
This sounds so hard.
I would
No.
not be, I literally would just end up just like peeing a trail like through my house. But anyway, go ahead. Sorry.
That's what everybody says to me, but this is actually the easiest form of incontinence to overcome. People are
Okay.
sometimes better after just one visit once they understand what is happening. So that it's not because your pelvic floor is weak, otherwise you would have been peeing while you were running, which is
Right.
stress urinary incontinence. Urge incontinence is more because now your brain is focused in on that toilet that you
Totally.
can't wait to get to the toilet,
Totally.
right?
That's totally it.
So here's some other tricks. You go up and down on your tiptoes 10 times. First, you take your breaths, then you go up and down on your tiptoes. And then I want you to solve a complicated math problem in your head.
This
Like,
is too mean. I need to go to the bathroom.
That is
you'll get there
crazy.
eventually. It doesn't have to be a math problem, but if I were having this problem, that's what I would do because it takes so much attention, like a complicated long division problem that where you really have to think and you can't think about your bladder because you have to think about the problem. And then you just delay going to the toilet. You walk slowly to the toilet once you've done all that. Sit down and then pee. Now, the worst that can happen is that you will still wet your pants, but I can almost promise you, because I've seen it work so many times, that if you keep trying those things, eventually you'll
It'll get
overcome it.
better.
Yeah.
Okay. Okay. That must be very common because when we were talking, we were both describing the same thing.
It's very common.
Yeah.
Yeah. And it's easier to solve, like I said, than stress urinary incontinence is a much more difficult thing. That's like peeing with coughing, sneezing, laughing, lifting,
Yeah.
pumping.
And that kind is harder to remedy.
Yes, because it requires increasing, a lot of times increasing pelvic floor strength, increasing core strength, increasing or improving coordination of the muscles of the pelvic floor so they can contract quickly.
Hmm.
So let's say peeing with jumping. So I get a lot of HIIT workouts are super popular now.
Hmm.
So a lot of my population are postpartum recovery,
Hmm.
or and these women want to go back to their HIIT classes, but they can't
Yeah.
do the jumping part. They can only do the strengthening part or the cardio part. And so we do drills where we work up to doing those kind of things step by step to get their muscles working when they need to work.
That
So
makes
that takes
sense.
more time. It takes more time because it requires strengthening, which requires time.
Right. That
Yeah,
makes total sense.
and compliance. So the patient also has to do home exercises, and the ones that come in and say, "Well, I didn't do any of my exercises this past
It's
week,"
not
blah
working
blah blah,
then.
Exactly. You're
and they're
not going to
not
get
any
any better.
better, and they're not any better. Yeah.
Right. That makes sense.
Wow. Okay. Wow. This is way more involved than I think. Well, definitely more than I thought before I started doing research about this. And I'm sure so many other people are like, "Oh crap, that has to do with it? Holy cow."
Yeah.
I think
Um,
it probably affects everybody, if I had to guess.
well, yeah, I would think so. Um, and so I was looking through it, it looks like some of the things that we talk about as far as, take care of yourself, be healthy, manage your stress. It sounds like a lot of those same things can apply to making sure that maybe these issues don't come up. Like, eat enough fiber, drink enough water, get enough sleep, like maintain a healthy weight, have a strong core, like all of this kind of stuff. It sounds like a lot of basically we just all need to live better.
Yes, for sure. So I do have to, with my bowel patients, I have some people who are sent to me because they have chronic constipation.
Hmm.
That's
Oh,
actually can be a pelvic floor problem where their muscles contract when they're supposed to be relaxing, which can cause stool to back up into the colon. But
Oh.
I'm not a nutritionist. If it's really complicated, I try to refer people to somebody that I refer to commonly who's a functional nutritionist.
Hmm.
Um, but if they don't choose to do that, I just do the best I can with kind of changing their whole diet.
Mhm. Wow.
If people have these issues, especially like things that we all think are just natural, we think we sneeze and a little bit of pee comes out. We think that
Yeah.
happens to all women. Everybody does it. It's no big
Yeah.
deal. And we just go on with life and we don't do anything about it. Are there long-term consequences to our health by not taking care of our pelvic floor issues?
Well, only in the sense that your leakage will probably get worse
Yeah.
as
Oh.
you age, to the point where when you're an old lady, you'll have to wear diapers.
Great.
So,
Diapers.
yeah.
Oh.
So it is not true that every woman leaks, and it's not true that it's normal. And unfortunately, the media, the people who sell poise underwear,
Yep.
Mhm.
lead everyone to believe that, oh, this is normal. This is what all women do. Just wear these underwear and no one will know that you peed in your pants because it'll absorb all the pee. Well, instead of accepting this as a foregone conclusion, you can do something about it.
Mhm. What I hear you saying is that this isn't inevitable. Like, it's not just like, "Oh, you're X age, these things are going to happen to you, and you have no recourse whatsoever."
Correct. Those things, that's not true.
Okay. So
Yeah.
there's hope.
And there is hope. Yes, for sure.
Aging does not have to, uh, include urinary incontinence and
No,
constipation.
it does not.
Well, that's very good to know. That's very uplifting.
On your
It's
web,
a little
on your
sad.
web, on your website, I saw you do something called pelvic floor dry needling. What is that? And what's it for?
Dry needling is something I do for all kinds of different muscle groups.
Uh-huh.
Um, it's using a needle that's the same needles that acupuncturists use, but I'm not doing acupuncture. So it's easier to picture and understand if you had a knot in your shoulder up in here in this muscle. I would put you on your side and I would insert the needle in that knot, and
Mhm.
the needle causes the muscle to contract. It's called a twitch response. And the end result of making a tight muscle twitch like that multiple times is it relaxes it afterwards.
Hmm.
Dry needling can be done on any tight muscle. I don't do it internally. That would be impossible, but some of the superficial pelvic floor muscles can be needled. I would say I don't do that as commonly as I needle other muscles though, because it's very uncomfortable. So that's the last resort.
Ah, okay.
One thing that I do now that I've done for the last 6 months that's not on the website, or maybe it's on there somewhere, I'm not even sure anymore, is something called shockwave. Uh,
Oh, it is on there. You have a little video about it.
yeah,
Mhm.
okay. That has been a big game changer for a lot of things. So it was originally it originally came out in the 80s, I think, for something called lithotripsy, which is when people had kidney stones, they would use this shock wave over the kidneys to break up the kidney stone. And they would have to put people under anesthesia because it was very powerful shock waves. So it was later tooled down to treat more orthopedic problems like tendonitis, muscle strains, rotator cuff problems, any kind of musculoskeletal problem. And it's been around for a long time, but only in the last few years has it now been used in pelvic health. So I'm one of only 3 pelvic health practitioners that has this machine in Georgia right now, because it's super expensive. But for instance, going back to the vaginismus patients,
Mhm.
if I put the shock wave, which sounds like it would be painful, but it's actually ultrasound waves. It doesn't hurt in that area. Feels kind of like you're getting snapped with a rubber band, but it doesn't really hurt. Anyway, I can get people to go through those dilators in twice the speed as I was before because it,
Interesting.
it kind of numbs the tissues and it brings a lot of blood flow to the tissues, which helps the muscles relax and helps kind of break that spasm.
Hmm. So one thing that this is making me think about is that, especially with, like the muscles that connect to the pelvic floor and, everybody's talking now about how sitting is the new smoking and sitting is so bad for you. And we
Mhm.
we all sit at our jobs, you know, I don't know about y'all, but I'm sitting right now, you know.
Yeah,
Are
I
you
just have a standing desk. I could stand up.
Oh, there you go. See, I don't,
yeah.
but I should.
I
Uh,
always recommend standing
so
desk.
do you see that people who sit a lot for work have more instances of these types of issues, or is it, say maybe like people who, are on their feet a lot, or I mean, do you know what I mean? Like,
Yeah.
is there one thing or another, or maybe one set of lifestyle things that you see that make somebody more prone to these kinds of things? And if so, like, you know, what do we do? Like, does everybody need to get a standing desk? Like I feel like maybe I'm getting a little alarmist, like, oh God, what can I do so this doesn't happen to me?
Right. I don't know that a sitting job is going to make you more likely to be incontinent, but if you already have a pelvic pain syndrome of some sort, sitting
Hmm.
typically does make it worse. So I try to get my patients who have pelvic pain to stand up frequently. And if
Hmm.
they can get a standing desk, that's highly recommended. And if they can't, at least stand up behind their chair, and I give them a couple little exercises they can do, even just for 30 seconds, to break up that monotony of that sustained posture of
Hmm.
sitting.
Hmm.
Yeah.
Okay, good to know.
If you could like reach the mass public with your message and say, this is what I believe and this is what we should do, what would you tell people about pelvic health and what needs to happen in this country?
Well, one of the things I would say is that we should be more like Europe, where every woman who has a baby goes to a pelvic floor therapist
Oh my
automatically.
God, that would be
Wow, that would
it,
be amazing.
exactly. Yes,
Yes.
100%.
And it's just not done here. OBGYNs just kind of have this attitude that women have been giving birth for, millions of years, and why should you have to go to a pelvic floor therapist? Well,
Oh
a
my
lot of the
God.
things that we have talked about today could be stopped in their tracks or prevented in the first place if you just
Hmm.
had some knowledge. So just any woman who has a baby should just refer themselves to a pelvic floor therapist at 6 weeks postpartum, just to see how are those muscles functioning? Are you
Hmm.
leaking? This is how you can prevent it. And give them a graduated exercise program, because it is not okay for doctors to say at 6 weeks, at the 6 weeks postpartum check, go back to doing whatever you did before, even if that is high impact exercise. Even their own guidelines, the American College of Obstetrics and Gynecology guidelines say no high impact exercise until 12 weeks. And yet, literally every one of them says to their patient at 6 weeks, just go back gradually to whatever you were doing before.
No
Hmm.
way.
And so those are the women that have been leaking ever since they had a baby 3 years ago,
Yeah.
with jumping and running and stuff, because they never got the graduated program to build them up to that, be
Hmm.
able to do that. It's like training. It's like if somebody had knee surgery, an ACL reconstruction, you wouldn't just tell them to go home and figure it out. You would send
Yeah.
them to a therapist, and they would do rehabilitation. I think women need rehabilitation after having a baby. And I would say any woman who's leaking, I don't care if she's been leaking for 30 years, you can at least improve it.
Wow.
You refer yourself to a pelvic floor therapist to find out, exactly why you're leaking and see what can be done about it.
And does insurance, I mean, yes, all, insurance, there's going to be some variation, but is this something that insurance will generally cover? Or is this one of those things that's like, okay, this will help you, but God help you if you don't have any insurance or any cash for it?
So here's the deal with pelvic health, and this is
Uh-oh.
probably not going to be a popular comment I'm about to make, but so technically it is covered
Okay.
if there's a complaint. Like
Okay.
someone has to have urinary leakage or pain or something. You can't just go for a checkup because you're curious and get that covered. Um,
Well, damn it. Sorry.
You
but
just complain.
the problem,
Exactly.
so the way physical therapy works in general, not pelvic floor therapy, but physical therapy in general, is that insurance reimburses very little for physical therapy. Okay.
Mm-hmm. Mm-hmm.
And for that reason, when you go for anything, whether it be your shoulder, your neck, your back, if you've ever gone to physical therapy, the therapist usually has 3 or 4 people
Yeah.
they're working with at the same time. And the
Mm-hmm.
reason for that is because they're not getting reimbursed enough. They can't possibly spend an hour with everyone. But for pelvic floor, because of the nature of what we're doing internal exams. I can't possibly see another person at the same time.
Right.
It's one-on-one for an hour. So I don't take insurance, and most pelvic floor therapists who I guess are have the same level of training that I have also don't for the exact same reason. We just can't do it right. You can go to some of the big, I won't name any names, but we'll call them big box therapy companies
Mhm.
that are
Yeah.
nationwide.
Yeah.
Um, they will send a therapist to a 3-day weekend course on pelvic floor, and then they'll go around telling all the doctors in the area that we do pelvic floor therapy and we take insurance. And then those people don't get the care that they need because what I took that course, and when I came out of that course on Sunday night, I'm like, I don't know what the hell I'm doing. I really just, there's so much to learn. I mean, the program I went through was 20 to 30 hours a week for a year.
Wow.
And so you can't compare, but the public doesn't know. The public
Okay.
just assumes that, oh, they do pelvic floor therapy. I can just go there and they'll take my insurance.
So if I'm somebody looking for say if I've complained to my doctor, I've got whatever issue, or I've got back pain that won't go away with whatever my doctor's doing, I'm thinking, oh, maybe it's a pelvic floor issue, and I decide I want to try to find a pelvic floor therapist. What questions do I need to ask? What should I look for as far as their credentials? Yeah, I guess those are the two biggest questions for anybody who's like, I need to figure this out. What do I do?
I'll tell you what to ask. I just don't know if you're going to get an honest answer, is the problem.
Well, there's that.
So you need to ask, what training has your pelvic floor therapist been through? And
Okay.
you can even say, I've done my research and I know that, let's just say your problem is you've got like a bowel problem.
Hmm.
Well, you don't learn anything about that in that first 3-day course at all. You've got to go to some advanced courses to even know how to do a rectal exam. It's not covered in that first class. So technically, you can't treat a bowel problem unless you can do a rectal exam. And yet they are telling people, oh, yeah, we treat that. And they'll do things like they'll give them Kegels. They'll do
Oh my
one
God.
internal exam and then they'll give them exercises and turn them over to like a college student that works there as a tech and have the college student show them exercise. This is what happens when you go to a place like that. Now, I can't say across the board that there's no place on the face of the earth that has a well-trained therapist that takes insurance. I
Hmm.
just know
Right.
in my area there is not.
Right.
So you would
So,
need to know, you would ask, like, what courses exactly have they been to?
okay. So what, I mean, how many programs are there that actually teach what somebody needs to know to be uh adequately
Train.
certified to do
Yeah.
this?
So there's a company called Herman and Wallace,
Hmm.
and they have a whole litany of courses that you can take.
Hmm.
And the course that I'm talking about that most, new pelvic floor therapists have been to, or these places send them to, is
Hmm.
Herman and Wallace level 1. It's a
Okay.
3-day course, but then there's Herman and Wallace level 2A, level 2B, and then there's all these other courses. So that's not the
Mm-hmm.
one I went to through.
Okay.
Another one is the American Physical Therapy Association also has a track that you can follow with multiple
Okay.
courses. What I did is I wanted to like get it done and I wanted to do it all at one time. So Evidence in Motion offered a pelvic health certification program that lasted a year. And it was
Mm-hmm.
just really arduous. Like we covered everything from A to Z, and we had weekends where we had to go all meet together and
Mm-hmm.
do labs. So those are the three.
Okay. And so just to be sure, like you're asking somebody, okay, what are your credentials, blah, blah, blah. Do they have to report or show somewhere what those credentials are? So if you're like, I don't think this person's telling me the truth, where can I go to check it out?
No,
Shit.
no, it's the state of this profession is really not, it's not great in terms of controls of things like that. So literally
Mm-hmm.
anybody can just go to a weekend course and say they're, I've even had them post things on Facebook, like on these community Facebook groups where people are saying, I'm looking for a pelvic floor therapist that takes insurance. Well,
Mm-hmm.
somebody from that company that I'm talking about piped up and said, oh, all our therapists are certified through Herman and Wallace. So I DM'd her directly. I didn't like call her out in public and said, I just want you to know I know who those therapists are and they're not certified. They went to a weekend course. That's not the same thing. They got a certificate saying they passed that class. And she was very apologetic and said, oh, I'm sorry, I didn't know. That's just what I was told by our marketing person. So
Right.
that's what the marketing person is telling all the doctors.
Oh my God. Well, you know what? Thank you for saying all that. And I think
Just do your Kegels,
just
Raquel.
Exactly.
That's the answer
I
to
don't even know if I do Kegels right. I don't know.
right.
I'm
How
like,
do you know if you do them right?
yeah,
Anyway, that's their
yeah,
answer to everything is do Kegels, do
just do
Kegels.
Yeah.
Kegels. Yeah.
Just do
Well,
your Kegels.
thank you for answering that question, Judy, because it just goes back to what Jennifer and I have said more times than we can count, that we have to be our own advocates. We have to get second and third opinions. We
Ask questions,
we
do
have to ask
research.
questions. You can't just be like, oh, do. This is what they told me to where I should go. Bloop, bloop, bloop. No, yeah. So I'm just real hot under the collar right now.
Yeah.
I mean, that's
Welcome to my world.
Yeah.
it's the nature of women's health in general. Like, what
Hmm.
did they say? Like 90% of the studies are done on men anyway. So
Yeah. I'd
women's
say
health,
I would guess it's probably higher than that.
women's health always kind of gets, not to say that men can't have pelvic floor issues, but
Right.
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 women's health gets sent
Mhm.
to the side more often than not. It's in your
Yeah.
head. Do some
Right.
Kegels.
Right.
Yeah.
Exactly. Yeah.
Right. Exactly. That's exactly what happens. In fact, there was a study done recently, just reported in May, of these researchers that asked over 400 women a set of questions like, have you ever been told that your pelvic pain was in your head? Have you ever been told that you should just have a glass of wine? Those kind of things. And the percentages were really high.
Yep. Loosen up, lady. Have a glass of
Yeah.
wine and do your Kegels.
Right.
Oh, well, Judy, I am so very glad that you're doing the work that you do, and that you're helping people that you're helping, like all
Thank
the
you.
people. And if nothing else, you're getting the word out there, and hopefully people will now listen to this and do some research and go, oh, let me figure this out. Let me go and talk to somebody else.
Yeah.
Right.
Yeah. Thank you.
Yeah. I would just say also that if someone does opt to go to a place that takes insurance just simply because they really can't afford to go out of network, and I
Mhm.
understand that that's going to be the case for some people, that if they don't get better or there's problem isn't solved, then they just need to know that they probably just weren't getting the right care. And they may have to figure out how to go to somebody who's more qualified.
Yeah.
Mm. Well, again, thank you for doing the work that you're doing, Judy, for you and your team and at your clinic, that you're helping so many people. So thank you for doing
Thank
that.
you. I hope so.
Ready to recap, Raquel?
Yeah. Okay. First off, I need to address the fact that I am just so hot under the collar about all of the misdiagnosis that happens with everyone with medical issues, but specifically women, and that uh, that medical schools are not teaching. I know medical schools, they got a lot to learn. I know, I get it. It's a lot, but
It's funny watching you right now.
because I'm really pissed. But come on. I mean, at least be taught enough to know that it's not that Kegels and a glass of wine aren't the answer for everything.
Giggles in a glass of wine.
Damn it.
Loosen up, lady.
Damn it. Okay, so yeah, so
I think
yeah.
I think the thing that really speaks to me, thank God for people like Dr. Rossi. The thing that speaks to me is I think I've been losing a little pee since I was like in my 20s, like with a
Probably.
sneeze or running or whatever. And to hear that that's not normal, I just thought that was a normal part of being a woman. Like,
Mm-hmm.
that's not normal. And I bet every woman I know is doing the exact same thing and some worse.
Yep.
Because I happen to know, I run with a bunch of women, or I
Mm-hmm.
did. I'm not running
Mm-hmm.
right now, but I did. And all of us were wearing that period underwear, the period underwear,
Yes.
just in case we had a little,
A
not for our
little
periods,
accident.
a little pee on the run, because it happens. So
Wow.
every woman I know is experiencing something like, I mean, I haven't talked to every woman I know, but the women I've talked to,
But I would,
enough women.
yeah, yeah. Again, society is doing women a horrible disservice
Yeah,
by saying, first of all, by not taking what's happening with women seriously, whether
right.
it's, I sneeze and a little pee comes out, um,
Pain during sex,
or
just
pain
loosen up,
during
lady. It's in
sex,
your head.
right? Or, uh, dude, I'm bloated and I'm constipated and whatever. Oh, just eat a little more fiber. Okay, I've been eating all the fiber. What the
Right.
hell? Right? Like, or whatever else it is. Like, quit just blowing this shit off and and point women in the right direction. Like, make sure that this information is available so that people can get the help that they need. And society needs to quit saying that, oh, this is normal, just suck it up and deal with it. Pain during sex is normal. Go ahead and just take it. What? No.
Well, that's why I'm really glad that Dr. Rossi was on today,
Mm-hmm.
because her voice is powerful. She's saying this is not normal,
Mm-hmm.
right? And I think it's important for us to hear that, because that's the biggest thing I'm taking away from this.
Yeah.
Is I just thought that that's what women did.
Mm-hmm. I think we all did. I mean, I know I thought that. I literally thought that any woman who had a baby is, she's gonna pee a little if she laughs really hard or
Okay,
coughs.
but I knew that I was already losing pee when I sneezed
Mm-hmm.
long before I had a child.
Wow.
So I was like, yeah, I'm telling you, in my 20s,
Yeah.
I would sneeze and a little bit of pee would go. Thanks, everyone. Yeah, thank you. Thank you. So proud. So proud of my little bit of pee. But the reason I'm saying it is so that other people will hear me like
Mm-hmm.
that. I was doing that in my 20s. So I
Mm-hmm.
imagine a lot of women are.
Mm-hmm.
I just thought it was normal. I just
Mm-hmm.
thought It's part of being a woman. Yes, I heard the stories. You're going to have a baby and it's going to get a lot worse. I can't
Right.
say it got any worse for me having babies. Of course, I had C-sections, so that's why I asked that question. I can't say it's any worse or any better than it ever was, but it sounds like I've had pelvic floor issues since I was young,
That's what it sounds
right?
like to me. And
Yeah,
saying that, I want to highlight what Judy said, that even if you've been having this issue for 30 years or however many years, you can still get some improvement. So anybody listening to this who is like, well, okay, maybe if I'd caught it the first year or the first 5 years, what? No, 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 no. There's still help. There's still hope for you.
yeah. Getting tired of peeing my pants.
Right. Exactly. Exactly. I just want to put out there this. I know we do calls to action a lot with our show, but this one for sure, call to action. Send this to, definitely send it to all the women that you know, but send it to some of the guys too, because pelvic floor issues can happen to men too, because they have a pelvic floor too. And I'm sure their issues are getting misdiagnosed. They're probably getting pumped full of, whatever medication that isn't helping. And they're like, I still got pain. I still got whatever. What the hell? You don't have to just live with it.
That's right. Get yourself some help. Find yourself a Dr. Judy Rossi.
Exactly. Yep. And I will put Judy Rossi's contact information and the information for her clinic in the show notes. I know she's only in Georgia, but maybe you can get some information if you live in another state and go, hey, what do I, do you have a recommendation for somebody in my state or something like that? So just putting that out there.
Yep. Interesting episode. Learned a lot.
Absolutely. Yeah.
Thanks, Raquel.
Thanks, Jennifer. Thanks for listening to today's episode. If you like this episode, please share it with a friend.
Or you could leave us a comment and a 5-star review, or email us at madnesscafepodcast@gmail.com.
Thanks, everybody.